Finding the right specialist could be the single most important thing you do after getting a mesothelioma diagnosis. Mesothelioma is so rare that most oncologists see few or no cases in their entire careers. The difference in outcomes between being treated by an experienced specialist and a general oncologist is substantial, and so is the difference between treatment at specialized centers versus community hospitals. Today, I want to give you a step-by-step guide to finding a mesothelioma specialist, what to look for, what questions to ask, and how to get evaluated, even if you live far from the major cancer centers where these dedicated professionals practice. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But finding the right specialist is critical for getting the best possible care. So let's start with why you need a mesothelioma specialist rather than a general oncologist. Mesothelioma is extraordinarily rare. There are only about 3,000 cases diagnosed each year in the United States. Of that number, a community oncologist might see one case every few years, and many never see a case at all. As a result, no matter how good a general oncologist may be, they simply can't develop expertise with such limited exposure. This is especially true because treatment for mesothelioma is evolving so rapidly. New immunotherapy combinations, novel surgical approaches, refined protocols for HIPEC, these advances happen at specialized centers and take years to make their way out to community practice. Specialists who focus on mesothelioma are the first to know about these advances and offer them to their patients. Treatment decisions in mesothelioma are nuanced. Should you have surgery? Which surgery? Should you start with chemotherapy or immunotherapy? These answers to questions require expertise that comes from seeing many cases and understanding the subtleties of the disease and the strategies for treating it. Outcomes are measurably better at specialized centers. Multiple studies show that patients treated at high-volume centers with mesothelioma expertise survive longer and have better quality of life than those treated at community hospitals. Now, I'm going to take a quick break here and ask you to do me a favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. So, where do you find mesothelioma specialists and how? Start by identifying which cancer centers have dedicated mesothelioma programs. Major centers known for mesothelioma expertise include Brigham and Women's Hospital in Boston, the MD Anderson Cancer Center in Houston, the Memorial Sloan Kettering Cancer Center in New York, University of Chicago Medicine, UCLA Medical Center in Los Angeles, UCSF Medical Center in San Francisco, H. Lee Moffitt Cancer Center in Tampa, and many others. Each of these centers has multidisciplinary teams who are specifically focused on mesothelioma. That's not just one doctor, but teams of doctors, including thoracic surgeons, medical oncologists, radiation oncologists, pathologists, and support staff, all of whom have mesothelioma expertise. Beyond cancer centers, try to find those that are NCI-designated comprehensive cancer centers. The National Cancer Institute designates certain cancer centers based on their research excellence and comprehensive care. While not all NCI-designated centers specialize in mesothelioma, many do, and this designation indicates especially high-quality cancer care. NCCN member institutions are leading cancer centers that develop treatment guidelines, and many have mesothelioma expertise. You can search the National Comprehensive Cancer Network, or NCCN, website for a list of these facilities, as well as our own website, mesothelioma.net. You can also contact mesothelioma advocacy organizations like the Mesothelioma Applied Research Foundations. These organizations maintain lists of mesothelioma specialists and treatment centers. And don't be hesitant about asking your current general oncologist for referrals. They know the importance of specialized knowledge, and since they don't specialize in mesothelioma themselves, they should be eager to help you find the centers and professionals that do, and they can probably facilitate referrals. What should you look for in a mesothelioma specialist? Volume matters enormously. Ask how many mesothelioma patients any physician you speak to treats per year. You want someone who sees 50, 100, or more cases annually, not just a few. If surgery is being considered, ask how many mesothelioma surgeries the surgeon performs per year. For complex surgeries like cytoreductive surgery with HIPEC or pleurectomy decortication, you want a surgeon who performs dozens of these procedures annually. Look for facilities that rely on multidisciplinary care models, where your case is discussed at tumor boards with surgeons, medical oncologists, radiologists, and pathologists who collectively review your information and recommend coordinated treatment plans. Research involvement is a positive sign. Doctors who participate in mesothelioma research and clinical trials practice at the cutting edge and can offer access to novel treatments. Board certification in a relevant specialty like medical oncology or thoracic surgery is essential, and hospital and center reputation matter. For more information, you can also check U.S. News & World Report's hospital rankings for cancer care. How do you get evaluated at a specialized center if you live far away? Most major centers accept out-of-state patients. Distance should not prevent you from getting expert evaluation. Contact the cancer center directly and explain that you've been diagnosed with mesothelioma and want to be evaluated by their mesothelioma team. Most of these facilities have nurse navigators or patient coordinators who are there to help new patients schedule appointments and navigate the system. After you've done that, gather your medical records. You'll need pathology reports, pathology slides, imaging studies on disc, operative reports if you've had procedures, and other relevant medical records. The specialist will want to review these before or during your first appointment. Many centers offer expedited appointments for cancer patients. You might even be able to get in within a week or two, rather than waiting months. Your first appointment will likely involve meeting with multiple team members, medical oncologists, surgeons, if appropriate, and nurse navigators. They'll review your records, perform a physical examination, possibly order additional testing, and then discuss your treatment options. What questions should you ask these specialists? Start with how many mesothelioma patients they treat per year. What treatment do they recommend for your specific situation and why? What are the alternatives? What are the expected outcomes with the treatment they're recommending? What are their survival statistics for patients like you? What clinical trials are available? How will treatment be coordinated if I need care both here and closer to home? You might be wondering whether it's okay to get a second opinion. You absolutely should see specialists at multiple centers if at all possible. Different centers sometimes have different philosophies and approaches, and hearing multiple expert opinions will help you make an informed decision. Trust me, no reputable specialist is going to be offended by you seeking a second opinion. Now, what about the logistics of traveling for care? Many specialized centers have relationships with hotels offering discounted rates for patients and their families. Some even provide temporary housing through organizations like the American Cancer Society's Hope Lodge. And air travel can be arranged through charitable organizations like Corporate Angel Network, if you qualify. Consider a hybrid approach where you receive major treatments like surgery at the specialized center and then get follow-up care and routine appointments with your local oncologist. The specialist can coordinate with your community oncologists to ensure a continuity of care. Now, what if insurance doesn't cover care at the specialized center? Contact the facility's financial counselors. They can usually help work with insurance companies, and many centers will accept patients even if insurance authorization is complicated. Don't let insurance concerns prevent you from at least consulting with specialists. Get evaluated first, then work out the coverage issues. What if you can't travel due to your advanced disease or poor health? Some centers offer telemedicine consultations, where specialists can review your records and provide recommendations remotely, though in-person evaluation is always preferable if possible. At minimum, have your pathology slides reviewed by mesothelioma pathology experts, even if you can't travel for treatment. To review, find mesothelioma specialists by identifying cancer centers with dedicated mesothelioma programs like Brigham and Women's, MD Anderson, Memorial Sloan Kettering, University of Chicago, UCLA, and others. Look for high-volume doctors who see 50 or more cases per year. Look for multidisciplinary teams, research involvement, and strong reputations. Contact the centers directly to schedule an evaluation and then gather your medical records to show them. Ask about volume, outcomes, and treatment recommendations, and get multiple expert opinions. Also, don't let distance or insurance concerns prevent you from consulting with specialists. You can visit mesothelioma.net for more information on specialists and treatment centers all over the country, or call 1-800-692-8608 or use the live chat feature on our website to speak directly to one of our patient advocates. As for me, remember to post questions below, and I'll see you next time.